Hi, I'm Ariela, and I'm in my high school's medical program.
Hi, I'm Ismhael. I was in middle school and I was in the medical program. I'm going to high school and I'm also in the medical program.
Today, we're going to talk about a disease, a really contagious one, which is strep throat.
So first I'm going to give an overview of what strep throat is. So this is a highly contagious bacterial infection that occurs in the throat and the tonsils. It usually spreads by air droplets, such as by coughing or sneezing, and also by touching contaminated surfaces. So while this is a bacterial infection, it is really common as there has been more than 3 million cases reported in the United States per year. However, it is usually really easily treatable.
Strep throat originates. Strep throat is caused by the group A Streptococcus bacteria, which is highly contagious. It spreads through respiratory droplets from coughing or sneezing. It spreads through shared foods or drinks which are contaminated and touching contaminated surfaces and then touching your mouth or nose. It is important to notice that people can carry the bacteria without showing any symptoms and still infect others.
So, as Ismhael mentioned, that strep throat is caused by group A of Streptococcus bacteria. Then I want to explain the other main groups of strep. So there's a group A, which was mentioned before, which causes common infections such as strep throat, impetigo, and scarlet fever. Then there's also group B, which causes more serious infections in newborns such as blood infections, pneumonia, meningitis, and in adults it could cause urinary tract infections and also blood infections. Then there's group C and G, which causes more localized and invasive infections. So now I want to explain the symptoms of strep throat. So there's many symptoms, but these are usually the most common ones. So it's sore throat, and it's usually very, very painful, intense sore throat. And once a doctor sees the throat, then the throat should be really red and have red spots. And we'll explain later with pictures how this looks like. But this is usually one of the symptoms of strep throat. Very painful sore throat. Also pain while swallowing, fatigue, headaches, also fever. It could be have a fever 101 Fahrenheit, nausea, vomiting, and also once the doctor sees the patient's throat, they could have enlarged lymph nodes, also white patches or pus in the throat, as well as rashes on the neck or body. And if it lasts more than 48 hours, a sore throat, it could possibly be strep. So now I'm going to explain the groups at risk of having strep throat. So usually strep throat is way more common in children than in adults. And children is specifically aged 5 to 15 years old. Children prior to having 3 years old is really rare to see, but it could happen. And also children who are in crowded settings such as daycares or preschools at school may also be more susceptible to having strep throat.
Diagnosis. There's 2 ways to diagnose strep throat. One is a rapid strep test. This is basically when a doctor takes a swab of the throat and the results come in a few minutes. The second one is a throat culture. This is when the doctor takes a swab to the lab and usually takes 1 to 2 days, but the results are more accurate.
So just to further explain what Ismhael said about the way to diagnose strep throat, so about the rapid strep test, so a doctor will always take the rapid strep throat test after they saw all of the symptoms of a strep throat. And if for some reason the results appear to be negative, then the doctor will probably send it to a lab, because if they saw the symptoms of having a red throat, swollen tonsils, then it's most likely strep throat. But since the results are negative, they'll want to confirm this just in case this isn't a false negative. So they'll send it to a lab where they can further see it, they'll culture it, and then they'll later see if it's actually strep throat or if it's not. So this is what he was talking about, of either a rapid strep test or a throat culture.
How strep throat is treated. Strep throat is treated with antibiotics. Common antibiotics include penicillin and amoxicillin. Most people begin to feel better within 24 to 48 hours of starting treatment. It is important to complete the full course of antibiotics even if symptoms improve early.
So now I'm going to explain the complications of strep throat. This is if no medicine was given at time and all the symptoms got worse. So first is rheumatic fever, which is an inflammatory disease that affects the nervous system and also the heart and the skin and the joints. There's also kidney inflammation, scarlet fever, which is a really high fever that is usually followed with a bright red rash, ear or sinus infections, and also toxic shock syndrome. This is a really rare complication of strep throat, but if it occurs, then this is a rapidly progressing disease, which could usually be really dangerous as well as leading to death.
Prevention. To help prevent the spread, you should wash hands frequently. Avoid close contact with infected individuals. Don't share utensils, drinks, or personal items, and cover mouths when sneezing or coughing.
So now I wanted to explain how strep throat looks. So I looked up a picture and now I want to explain the strep throat. So here it is. So here is the mouth of a person. You could see the top of the roof of the mouth. So you could see it's really red all around here. It's really red. It has these spots, which are usually called petechia. all these red dots over here, which is one of the key symptoms of strep throat. And you could see also here the uvula is really swollen and red. It's really inflamed, the whole throat and everything around. So these are like one of the things doctors look at, and they can immediately notice it's strep throat because of the redness it has, the extreme redness of the inflamed uvula, and also these red dots called petechiae. So this is just how I wanted to show how strep throat looks, so you could easily identify. Maybe you're at home and then you just see someone's throat who says, "Oh, it hurts a lot," and then you can identify it quickly and then go to the doctor.
So this is another picture of how strep throat looks like. So you can see here are the tonsils. They look red and inflamed, and they have white patches and spots. In my investigation of strep throat that I made some illustrations here. Streptococcus bacteria. This also shows fever and tonsils inflamed. This represents social distancing. And this is how the strep throat and rapid test looks like.
I wanted to show the notes I did on strep throat. Here it is.
Thank you for watching this video and us explaining what strep throat is.
I hope you really liked it, and we really like doing research on it and explaining it to you. Bye!
But the Lord stood with me and gave me strength. 2 Timothy 4:17.